Good morning. Thank you for joining us today on this webinar for the safe management of diabetes during end-of-life care. My name is Craig Marshall. I'm the Service Delivery Manager for our Virtual College's Health and Social Care Division, and I'll be taking you through this morning's webinar. So here's a quick look ahead of what we'll be going through. So we've got a bit of an introduction and some background information to cover. Then we're going to look at the existing courses available in the National Patient Safety Suite of courses, including the latest edition, End of Life Care. We're also going to look at some of the benefits of e-learning, how to access this training before we move on to the exclusive live demo of the Safe Management of Diabetes during End of Life Care e-learning course. And then we'll finish with a brief Q&A. So just by way of an introduction, Virtual College, we're an e-learning provider. We've got over 18 years experience working in this sector, and we're based in the UK, Ilkley in West Yorkshire, and we have over 1.3 million online learners. We're one of the fastest growing companies in Yorkshire and have been voted one of the top 6 e-learning providers in Europe. We work with nearly 5,000 different customers each year and over 500 key accounts. Customers are from a wide variety of sectors, including healthcare, NHS trusts and other healthcare organisations, councils, colleges, universities and training providers, and indeed commercial businesses. We offer a wide range of products and services, including learning management systems, online auditing tools, bespoke course development, mobile app development, and indeed continuous improvement, lean healthcare training and consultancy services. Our courses cover a wide range of areas, safeguarding children and adults, induction training, health and safety, health and social care generally, and indeed clinical healthcare courses. So here's some background then, just before we move on. So in 2010, the National Diabetes Inpatient Audit highlighted over 5,000 insulin safety incidents between 2003 and 2009. This prompted an alert to being issued by the then National Patient Safety Agency, stating that healthcare professionals are required to complete training in the safe use of insulin. The safe use of insulin course and indeed subsequent e-learning courses were then developed by ourselves at Virtual College in conjunction with NHS Diabetes, and these have now been accessed by over 225,000 healthcare professionals. Unfortunately, central funding for the suite ceased earlier this year, and now the courses make up the subscription-based National Patient Safety Training Suite. So essentially what we have is a collection of online patient safety courses developed here at Virtual College with our e-learning experience, our instructional design expertise, but in partnership with NHS England and subject matter experts in diabetes and patient care from across the NHS. So we're providing the technology and the e-learning expertise with the subject matter expertise around patient safety being provided by professionals in the NHS. There are currently 7 courses in the suite. We have the safe use of insulin, the safe management of hypoglycemia, safe use of intravenous insulin infusion in adults, the safe use of non-insulin therapies for diabetes, the safe use of insulin syringes, pen devices, pumps and sharps, and then the national curriculum for the training of healthcare professionals who care for children and young people with diabetes mellitus level 1, which is a basic awareness course. And then the latest edition is the safe management of diabetes during end-of-life care. So that's the focus of today. So just a little bit more detail on this particular course. This course is aimed at healthcare professionals who care for people with diabetes during the last year, months, weeks and days of their life. By undertaking the course, healthcare professionals will increase their understanding of the management of diabetes, helping patients to live as well as possible during this time. The course is structured as shown on screen. We have a quick welcome and some learning objectives, followed by some background, an overview of end-of-life care, looking at clinical care and diabetes and how that links in with end-of-life care, some diabetes treatments for insulin and non-insulin therapies, and then we're going to look at intercurrent illness and treatment withdrawal. After completing the course, healthcare professionals should hopefully be able to demonstrate a better understanding of the impact that diabetes has on end-of-life care, outline different stages in end-of-life care and how safe medicines management can improve patient experience. Also, we'll be able to describe the management of diabetes during intercurrent illness and when steroids are used. Looking a bit wider at the suite, so we've got a further 6 courses currently in development, due for release over the next few months, taking us into the next financial year. Total number of courses by the end of 2014-15 will be 13, and the subscription fees for the MPSS are going to be reinvested into future additional courses. So the next lot of courses we have then, due for release in September, we have the Safe Management of People with Diabetes, Dementia, Depression and Severe Mental Illness. Also, a new course taking the suite a little bit wider away from just diabetes. We're looking at omitted and delayed medicines in hospitals. Then we've got the Safe Management of Diabetes in Pregnancy for October. Get Moving, Get Healthy, which is a course that's aimed at service users that are living with diabetes. Safe Management of Diabetic Foot. And then finally, another course making the suite a little bit broader, looking at minimising the risk of harm from medicines overdose. So these are really important issues, and it's key that healthcare professionals are trained in all of these areas. But why would you use e-learning as opposed to traditional face-to-face delivery? Well, first of all, it's often cheaper than face-to-face training. It's very cost-effective to use an e-learning solution. It can be self-paced, so individuals can learn at their own speed. You don't have somebody sat in a training room that's struggling to keep up. Everyone can progress at their own natural learning speed. It's flexible. Individuals can pause lessons and replay and resume training at any time. If you only have a 10-minute slot, you can log in and do 10 minutes of training, leave it there, come back and finish later. And this is also why it's so convenient. It brings the classroom into the workplace and indeed the home. Whilst you can't advocate that people do training outside of working hours, it's a common fact that the majority of people that have access to e-learning will often do that at home in their own time rather than infringe on work time. It's also a really efficient way to deliver training. You can get to a larger number of people in a much shorter amount of time compared to face-to-face training, and you know that you're giving a consistent message to everybody, whereas the message that people get from face-to-face training might vary depending on the trainer. With e-learning, you know exactly what they've been taught and you know exactly the message they've been given. And it's also sustainable. It allows you to update training as you go along and indeed sustain training that's already been completed. To access the training then, we've got a really easy self-registration process. Once an organisation has bought into the National Patient Safety Suite, their staff can access the training via our self-registration site, and instructions on how to do this are supplied to all organisations who join. Individuals will have their own learner record where they will access their training and also receive updates regarding new additions to the suite. At present, the feedback for the MPSS is excellent. Here we have some analysis of over 15,000 evaluations that have been completed in 2014. When asked how easy it was to access the system and navigate through the module content, 38% of people said it was very easy, with a further 52% stating it was easy. And then again, looking at would individuals taking these training courses recommend them to other people? 93% of people have said yes, they would recommend the training to others. So the subscription options for a large organisation for 12 months access, this is for unlimited access to all of the courses currently available in the suite. As new courses come out, your subscription rates stay the same. It's just £5,000 plus VAT for the year. And that gives you unlimited access to all courses that are available at that particular time. 5 or more larger organisations can join together to receive a 10% discount, making that £4,500 plus VAT per organisation. A lot of areas within the same region have got together and clubbed in for a regional deal. Smaller organisations with a combined total of less than 5,000 staff can also join together but purchase one site licence for those multiple sites. So here are organisations like CCGs that might perhaps not have lots of their own staff can join together and still have access to this training at a really good rate. And the training is also open to individuals, so here we have just a table just showing the bulk discounts available for small purchases. The majority of courses are £30 per person, with the exception of the paediatrics course, which is £99. But if you do need to purchase in smaller quantities, the bulk discounts are shown here on screen. So next steps then, so first of all, check to see if your organisation already subscribes to the MPSS, because if they do, you can log on to the self-registration page and start accessing that training, just follow the instructions on the screen by going to http://nationalpatientsafetysuite.virtual-college.co.uk, and as I say, just follow the instructions on screen. If your organisation doesn't currently subscribe, then we would advise you contact your chief nurse or pharmacist or learning development team to advise them that you require this training, and they can look into arranging a subscription on your behalf. You can direct them to our website at the link shown below, http://www.healthcareacademy.co.uk/patient safety training suite. Alternatively, you can email our patient safety training manager, John Thornton. His email address is shown on screen, along with our phone number should you wish to speak to John. And if you do wish to just purchase courses yourself, you can follow the links again from that webpage to take you to the online shop. So now we're going to move into the live demo, so just bear with me while we log in and access the training, and we'll join back at the end shortly for any questions that we have.
Finally, before we get started, we just need you to be aware of the copyright and disclaimer associated with this module. Welcome to your module on the safe management of diabetes during end-of-life care. Jill Hill, June James and Professor Alan Sinclair will guide you through this learning. Here you can see the aims and the learning outcomes of the module. Before starting this module, you should have already completed the Safe Use of Insulin e-learning modules, and will also find it useful to refer to these resources. If there is a new and important word or phrase on a page, it will be highlighted to attract your attention, and the keyword icon will be displayed. Whenever you see it, click on the keyword icon to reveal the meaning of the word or phrase highlighted. Virtual College would like to say a big thank you to all those who have contributed to the creation of this module. We would also like to thank the individuals and organisations shown here for their contribution to the module. The content of this module has been independently certified as conforming to Universally Accepted Continuing Professional Development (CPD) guidelines. Finally, before we get started, we just need you to be aware of the copyright and disclaimer associated with this module. Here is a challenge. So what is end-of-life care? Take a look at an eloquent outline of the relationship between people needing end-of-life care and those providing the care. The outline was created by Dame Cicely Saunders, a pioneer in hospice care. Remember her philosophy and use it as a guide for everything you do in the safe management of diabetes during end-of-life care. Before we find out about best practice end-of-life care, let's take a moment to review an NHS-supported end-of-life care initiative that was recently withdrawn and how the lessons learned have helped to structure current best practice. Click where indicated for more detail. Whilst the LCP received criticism from some patients and members of the public, national bodies and organisations recognised the benefits it provided. The Royal College of Nursing, RCN, published a consensus report of the LCP. Follow the prompt. Despite endorsement from national bodies and organisations, ongoing concerns led to an independent inquiry led by Baroness Neuberger, senior rabbi at the West London Synagogue and former chief executive of the King's Fund, 2013. Follow the prompt to see. Now you have learned how the LCP divided opinion. To conclude this introductory section, here is a brief summary of lessons learned through the LCP. This summary is also a pointer towards current best practice and some of the topics you will cover as you move on through your learning. Here is a challenge. Drag and drop the separate word into the positions you feel are correct within the statement taken from an earlier page. When you are ready, click Submit to check your selections.
Okay, hopefully that was a good introduction to our e-learning and how that might look if you were to pursue and take the full course. So we'll just go back to our slides now. Any questions at this point we'll pick up during the chat box, so thank you for joining us. Do post some questions in the chat and we'll go through those now. If you do wish to get in contact with us to discuss access to the courses, please do refer back through the slides and follow the details that were provided. And again, thank you for joining us today, and we hope we'll see you on some of our future webinars. Thank you. Goodbye.